Facebook that I was in trouble with, but I am allowed on Facebook. So here we're on Facebook as well. But anyway, we're back on. Who knows why? But I'm back now, so that's good. Back on Instagram, Facebook, and all the other ones, YouTube. So I've got some questions. If anyone's got any questions specifically for me, then please feel free to ask them. But no fear, because I've got some already ordained here. This one here says, my husband has a cyst on his back that needs to be removed. What are the chances of it coming back? Yeah, well, the different ways of treating a cyst are sometimes people kind of like lance them, so sort of like just kind of like get the stuff out of it and empty them, and that kind of looks like it's got rid of them. The problem is the cyst wall remains, and if the cyst wall remains, they do come back. So I would say the best way to treat them would be to remove that cyst with the wall. So and if you remove all of the cyst with the cyst wall, then it won't come back. The problem is that there's the if. So there is a chance that when we remove it surgically, that we leave some of the cyst wall behind, and if that happens, it can come back again. So it has got a much lower risk of coming back if you have it removed surgically and have the cyst wall removed completely than if you just have it kind of lanced or something like that. So no one can ever give you 100% really success with any operation, really, to be honest with you, unfortunately. But in general terms, if it's kind of like a fresh cyst that's never had any infection, that's never been operated on before, there's a good chance. Doesn't sound good, does it? I can't give you figures, but there's a good chance it won't come back, because it depends on how it goes during the operation. But if it's a nice clean cyst wall that comes out cleanly, and sometimes it does, then it should not come back again, and that there's reassurance on that one. But sometimes if it is not clean, if it is not easy, if it's a bit scarred, if it's a bit stuck, it's a bit difficult to get that plane between the cyst and the sort of surrounding skin, then there is an issue that you could potentially leave some cyst wall behind. And some people do try and remove cysts through very small incisions. I usually use an incision about the same diameter as the cyst, but you see people who are trying to remove it through very small incisions, and through a very small incision, you can kind of puncture the cyst to get the contents out, and then when the contents are out, you can just try and tease out the cyst wall, which is great because it's a smaller incision, but it's even more difficult to ensure that you've got all of the cyst wall out, and so the chance of recurrence are higher. So it's always a balance about how you have it done. That's why it's always good to have a chat with the doctor or what have you, but to sort of balance up what the best way to remove it for you would be. Personally, I don't do that small incision and puncturing the wall and taking the sac out separately. I try and get the cyst out complete. Sometimes it does, sometimes you do breach the cyst wall, but and if you do breach the cyst wall, then you try and kind of keep hold of it to make sure you get the whole of the cyst wall out. So it's always the idea, but you can never 100% guarantee it. So it shouldn't come back. Personally, I always say, look, if it does come back, I'll do it again. In fact, I think I'll do one this week that came back, but I think it was already a current one when I saw her first time. But anyway, nevertheless, it's not that common, just because I'm happening to be doing one this week. Maybe it's next week, but yeah, so if it does come back, we wouldn't charge you, but the aim is to get it out and with the cyst with the wall completely, and so it doesn't come back again. So I just Terry, hi, I need to come and see you. Okay, Terry, come and see me then. You know what to do. Call me, Terry. Call me. You got my number, or email or message. Don't do it like this, Terry, because I will try and remember, and I'll try and get Amy to give you a call tomorrow. But I cannot be relied upon, so don't rely on that. Give us a call, or a message of some description. So yeah, so what are the chances of coming back? Slim, if it's a one-time cyst that hasn't been operated on. If it's been operated on before, then there's going to be scar tissue in the area. The plane is going to be less easy to identify. So the chance of leaving some of the cyst wall behind is increased, and so therefore the chance of recurrence are increased. So sorry, Terry, I can't see the questions. Yes, please. A lot has been happening. Oh, good God. Right, Terry, can't wait. Make sure we block out a bit of time then. All right, Terry, can't wait to hear what's been happening. Can diastasis recti repair be done after gallbladder removal for incision sites? Yes, for show. Absolutely fine, no problem at all for diastasis recti repair after gallbladder removal, particularly in this day and age, because it's all done by laparoscopic techniques, hence the 4 incision sites, so tiny little stab incisions. There's zero problem with that. The only potential problem with well, when you're saying diastasis recti repair, that's kind of implying you're having a tummy tuck. And the only potential problem with a tummy tuck in patients who had a gallbladder removal is back in the old days when they used to do an open gallbladder removal with what's called a Cocker's incision, which is a big cut underneath your rib cage. So that was a relative contraindication to having a tummy tuck, because that scar could kind of interrupt the blood supply of the skin and cause a problem with the healing. So but you don't really see that scar anymore, so there is no longer an issue with gallbladder removals and tummy tucks. And certainly for the diastasis repair, there's no problem with doing that if you've had a laparoscopic cholecystectomy. Absolutely no problem, which is another word for gallbladder removal. Just demonstrating my prowess with the words there. What injections of will injections of hyaluronidase get rid of a small lipoma? No. Funny question, because is that kind of, whenever people ask questions like this, I always think, what, has someone told you that it would? And I sort of question yourself, why would hyaluronidase get rid of a lipoma? I've never heard of hyaluronidase being used for a lipoma personally. Hyaluronidase is used to dissolve filler. Usually, if you put too much, so maybe that's it. Maybe you've had, you associate it with being used for filler. So if you have too much filler, then the hyaluronidase will dissolve the filler. So we'll kind of dissolve the lump in that situation, but it won't. That's because the lump is filler. So if you have a lump which is a lipoma, then that lump is fat. So hyaluronidase will not dissolve the fat. So hyaluronidase is not a thing that we use for lipomas. Not one I've ever heard of. So I don't know. As I say, I always sort of question myself a bit when people ask this question, because you think, have they read somewhere that it can be used for lipomas? I didn't know it could be used for lipomas, but I am very prepared to stand corrected. I might be wrong. God knows I've been wrong before. So, but yeah, I don't think hyaluronidase will get rid of a small lipoma. I don't think it'll have any effect on a small lipoma, personally. What do we got? Why am I finding it difficult to find a surgeon to close my lip piercing scar? Yeah, I mean, yeah, I don't like it. I don't like doing this sort of thing. It's difficult because I guess well, for me anyway, it comes down to sort of patient expectation, because I think the problem with a lip piercing scar is it's like a tiny little hole, and I completely understand why people don't want it anymore. The problem is you can't not have it anymore. You know, you've done damage to the skin, which has caused that hole, so you're going to have something. And you know, if we could get rid of it and cause nothing, then fine. But in order to get rid of it, you have to kind of like core out that hole, because that hole is kind of lined with skin. That hole is kind kind of epithelialized, so that piercing has made that hole line with skin. So you have to kind of like core out that whole hole front to back, so full thickness, and then close it somehow, usually like a stitch, put a stitch to close it. So it kind of causes a little scar. So and the little scar will be a bit red. It will fade, and hopefully it will be better than the hole, because it won't be a hole, but you know, it could kind of dent in, and because you're kind of coring out the hole, the scar will be bigger than the hole. So you're creating a scar that's bigger than the hole. Now, I'm not talking about massive amounts here, but you know, still, it's, you know, that's why I think, I mean, I don't know what other surgeons are like, but personally, I'm a bit kind of, you know, not massively kind of positive about closing piercing holes, because the resulting thing that we leave is often similar to the piercing hole, and it's kind of like, what's the point? So that is the point. I mean, you can close up the hole, but as I say, you'll leave a scar, and the scar will be slightly longer than the hole and might look similar to the hole. Obviously, it won't be a hole, but it'll be a mark, and you've currently got a mark there now. So you'll be trading one mark for another mark, and you might feel that the scar will be preferable to the hole. Great. But as I say, it could sort of tether in and cause a bit of a dented scar, and you might be like, what was the point in that? So that is the issue. Sorry, I can't, I've bent my phone. I've got a bent phone, and oh, hi Catherine. Tony's joined. Tony, long time no see. How are you? Sam Van has joined. Wow. Oh God, what have I done there? Add comment. Add comment. Or maybe if I leave it like that, I'll see who's joined. Well, nice to see you all. Blasts from the not too distant past. Hope you're all well. Sorry that I haven't seen you recently. Yeah, piercing scar thing. So why can't a keloid scar be surgically removed? Well, it can. A keloid scar can be surgically removed, but it wouldn't necessarily be the first line of treatment for a keloid scar. And the reason for that is because a keloid scar is caused by an abnormal, your body is reacting abnormally to the trauma, whatever it was, and has scarred excessively. So the keloid scar is a problem with a person's physiology. Normally, there are some situations which can predispose to really hypertrophic rather than keloids. There's a bit of a spectrum with hypertrophic and keloid scars, but certainly with a hypertrophic scar, sort of a bit of a nuance, the difference between the two, but basically a hypertrophic scar is a bit like a keloid scar, but not as bad. But certainly with hypertrophic scars, there are certain things, like for instance, if it takes a long time for the wound to heal, there's an increased risk of the scar becoming hypertrophied. So if you've got a reason for the scar to basically be lumpy, which is what we're talking about, lumpy scars here, there will be more positivity about removing it surgically, because you could say, right, well, if it took a long time to heal, that's why it's lumpy. If I can remove it and make it heal without taking a long time to heal, there's a chance it won't be lumpy. But if it would heal with no problems, and if it is really properly a keloid scar, then the worry is that we'll cut that scar out and give you a worse keloid scar. So that's why we don't like cutting out keloid scars. So often a keloid scars comes from a little thing. So you have a little thing, sometimes like an injection, blood test, tiny little thing, tiny little bit trauma, acne, ear piercing, tiny little scar, which goes massive. And then if we cut that massive scar out, we'll give you a bigger scar than what the original thing that caused the keloid was. And if that scar goes keloid, it goes even bigger than the first one. So that's why we are anxious about removing keloid scars surgically, and would try to do other means first. Things like massage, things like pressure, things like silicone sheets or silicone gel, things like steroid injections. Those sorts of things are usually done first, and surgery is reserved for really big ones, which we don't think are going to respond, or at least respond significantly to those non-surgical methods, or in situations where those methods have failed. But if you do surgery, as I say, we're always reluctant to do surgery because there's a risk that it could come back worse. So the way we mitigate that risk is we do what's called an intralesional excision of the keloid scars, which means you don't actually cut into any fresh skin. All the cuts are actually in keloid scar, so you're kind of debulking this keloid scar, you're making it smaller. So the aim is really to make a big keloid scar into a smaller keloid scar, which can then potentially be addressed with non-surgical methods like pressure and steroid injections to maybe get rid of the last part of it. So that's how I do it. I don't make any cuts in normal skin, so I do an intralesional excision, so it gives you a much smaller keloid scar, which we can then treat with steroid injections. But as I say, it usually is a last port of call, with trying the other things first if we can. What is the recovery time for Pinnaplasty, going to the gym and going on holiday? So you've got to be a bit careful with Pinnaplasty. It does involve quite kind of you're kind of changing the shape of the cartilage of the ear, and it is a little bit fragile in the first stages because you want to keep the shape that we create when we do the surgery. Now, personally, I don't do Pinnaplasty anymore, but other people at the clinic do, and it is a little bit fragile, as I say, to start off with, and you can potentially, pull the ear back out of shape if you are too aggressive. So you've got to be very careful. Now, in terms of going to the gym, now you're not going to actually put sort of pressure on your ear going to the gym, are you? Unless you wear a helmet and do boxing sparring. But I don't think many things are going to. So basically, going to the gym, that is going to be mainly getting hot and sweaty. So you want the wound to be healed. So after a couple of weeks, I would say first thing I'd say, check with your surgeon, because I don't do it. So check with whoever does it. But in general terms, I'd say you want the wound to be healed. So a couple of weeks, you can start doing kind of exercise and things like that. You don't really want to be doing anything too strenuous, and you certainly don't want to be doing anything where you could get trauma to your ear in terms of any kind of sports or anything like with any contact or anything where you could actually traumatize your ear for at least a month, probably 6 to 8 weeks, let's say 6 to 8 weeks before you're thinking about anything where you're potentially going to get anything kind of rubbing or whatever on your ear, and then just gently, because it will still be fragile. For the first couple of months, it will be fragile. Similarly, going on holiday, no real problem going on holiday except for the sun on the scar. Now, the scar's pretty well hidden. The scar's in the fold behind your ear, and it's usually pretty well hidden, but it will be red and active for the first 3 to 6 months. So you don't want to get a tan on it for the first 3 to 6 months. So if you're going on holiday involves tanning, then either don't go on holiday for 3 to 6 months, or keep it covered, wide brim hat. I mean, it's quite hard to get a tan on that part of your ear, to be honest with you, so I wouldn't over egg it. But that's the only thing I'd be worried about really about a holiday, unless you're doing an adventurous holiday where you're, I don't know, wearing a helmet or something, I don't know, which again goes back to the sort of couple of months before you want to be sort of putting anything that can kind of rub or contact to your ear. Holiday to somewhere not hot and not wearing a helmet is fine. After 6 weeks is normal for going on holiday for most operations. So it's really just making sure that first of all the wound's healed, so that's the first couple of weeks, and then just not traumatizing the ear for the first couple of months. In a nutshell, I would say that's it. So that's it. That is it. So yeah, nice to be back on the gram, and that is I'm out of questions. So if you've got any questions, please message me, phone me, or probably the main way is actually messaging or phoning me, and I will actually, I probably will be back next week, I think. Yeah, I will be. Holiday, isn't it? The holidays is kind of over now, isn't it? Yeah, so I will be back. So same time next week then, in God willing.